So, you know, you always get, right, the artery, the vein and the nerve. And they're going to join this, which is what? This structure along here.
The sympathetic trunk.
The sympathetic trunk, exactly. Okay? So that is the sympathetic trunk. So it's right up against the body wall. Okay?
Which one is the sympathetic trunk?
This is the sympathetic trunk.
Okay.
Okay? So what happens, what is the sympathetic trunk? Can you see? So this is the sympathetic trunk. Okay? So it's shown here.
It's like
This is the sympathetic trunk. And the sympathetic trunk is essentially what's shown here. Okay, so what's along the sympathetic trunk?
nerves.
Yay! Nerves. But what kind of nerves are they? That are coming out of these rami communicans from the spinal cord.
Motor.
They're motor,
And visceral.
they're visceral. Are they preganglionic or postganglionic? Preganglionic, exactly. They're preganglionic sympathetic neurons. And they are going to synapse with those chain ganglia, which are segmentally organized down that sympathetic trunk.
Can we see those?
Wait, so
Yeah, they're like
preganglionic nerve cell body, where is that?
ganglia here, here. There's small little swellings along the parapet. Yeah.
So spinal cord to the trunk, that's the preganglion.
Yes, exactly. So it comes out of the ventral horn, ventral root, spinal nerve, rami communicans, pop, 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 down to the sympathetic trunk. Okay.
And then off the sympathetic trunk is the chain.
The sympathetic trunk sort of basically represents the chain ganglia and then the axons joining the chain ganglia together.
Okay.
Okay, so that's the whole sympathetic trunk at that point. So at the chain ganglia, these are also called paravertebral ganglia. There is the synapse between the pre and the postganglionic sympathetic neurons. These are by definition sympathetic because they're thoracolumbar. There's no parasympathetic along here that we know of. There's no parasympathetic, all sympathetic. So there's a synapse between these preganglionic neurons coming from the spinal cord, synapsing at the chain or paravertebral ganglia. What neurotransmitter do the preganglionic neurons release? And what kind of synapse is it on the postganglionic neurons? Exactly. Okay? Now, so some of these neurons will come out of the spinal cord, down the rami communicans, they'll get to that chain ganglia and they'll synapse. And then that postganglionic axon may travel up or down this sympathetic chain. Now, not all of those neurons will synapse segmentally. Some of those preganglionic neurons will also go down towards the abdominal viscera or will come up this way towards the cervical and cranial part of the body. Okay? So say, you know, these preganglionic neurons are coming out and they don't synapse in this chain ganglia, but there's a continuation of this sympathetic trunk which comes up past the thorax into the cervical region, and so it continues up here, and here it forms the cervicothoracic ganglion. So this is an equivalent of a chain ganglion. It's just lots of them sort of joined together. So you can see it's very evident, you know, it's this whitish, sort of hard structure. This is the ganglion right here. That whole thing is a cervicothoracic ganglion. Okay? So these are the spinal nerves coming out here. This is T1, C8, C7, C6. Okay? And that's going to go to what? The brachial plexus. Exactly. So some of those preganglionic neurons will come out of the rami communicans up the sympathetic trunk and synapse here. Now, not all of them will synapse here onto these postganglionic neurons, but some of them will then travel and synapse here in this middle cervical ganglion, and then will send off postganglionic. The postganglionic neurons go to the end organ. But for here, we can see from this ganglion here, you can see nerves going off to innervate the heart, and not that one, sorry, these ones here, to innervate the heart and the lungs. So that would be the postganglionic sympathetic neurons going to the heart and the lungs and thoracic structures. And then these will synapse here or in the middle cervical ganglion. So those postganglionic neurons will then come up, and as you can see right here, they join the, which nerve is this?
Vagus?
The vagus, yeah. So that's kind of where it gets confusing, because what do we think about the vagus?
Parasympathetic.
It's parasympathetic, but at this point it's actually called the vagosympathetic trunk. So it's like, again, it's like train tracks, right? They're just using the sort of the same train tracks, is the way I tend to think about it. That sympathetic information is coming out of the spinal cord. It's got to get to this part of the head, comes up the sympathetic trunk, synapses on one of these ganglion, and then those postganglionic neurons just use the vagus as a way of getting to where they need to go. That's a very simplistic way I think about it. So that information is going up this way
Like
to the neck. Pardon?
Or like hitchhikers.
Yeah, exactly. Yeah, right.
So this postganglionic nerve to the cervix.
To the, which one? These are spinal nerves. So those are mainly somatic.
So they are coming in mid.
Yeah. Okay. So the vagus nerve, parasympathetic. Sorry. Cell bodies, brainstem, right? Coming out. These are preganglionic parasympathetic neurons. They're going to. They're giving off. The vagus here is giving off. So once it gets past this point where the sympathetic information joins it, we just call it the vagus. So this is the vagus. It's giving off branches also to the heart and the lungs. It's going all the way down. Comes to in the thorax. It splits. There's a left and a right. It forms dorsal ventral. Left and right form dorsal ventral, and then they merge to form the dorsal and ventral branch of the vagus. And that's how. So you can see here the ventral and the dorsal branch. They will join together left and right side, and then go through the hiatus into the diaphragm into the abdomen. Those are parasympathetic preganglionic neurons that will synapse with postganglionic neurons that are close to or in the end organ because they're parasympathetic. Yes, your question.
Where are the cell bodies for the preganglionic neurons? Are those in
For the
chain?
sympathetic,
Yeah.
they're in the central nervous system.
So they're in the spinal cord.
Exactly.
So what cell bodies are in the chain ganglia?
Postganglionic neurons.
Oh, okay. But
Yep.
then what about this ganglia?
They're also postganglionic neurons. So you can
there's an
imagine.
extra cell?
No, there's no evidence that they synapse twice. But it's just like some will synapse here
And some
others
synapse
won't.
there.
They'll just send axons and synapse here. Others will send axons, not synapse here, but just pass through it and synapse in the middle cervical ganglion. And others won't synapse there. There's another cervical ganglion up here, the cranial, and synapse there. So they're just using, this is they don't synapse in the ganglion, they just go straight on. So at this point, you've got pre and post ganglionic fibers in this sympathetic trunk. Actually, you have all the way down.
So the sympathetic is all in the sympathetic we've talked about. And it's thoracolumbar.
Right.
The parasympathetic is craniosacral, and the
Yeah.
cranio part pretty much refers to the vagus nerve.
Yeah, yeah.
And then a couple
For
other
the,
cranial nerves.
Right, some of the other cranial nerves,
Right.
remember, like the glossopharyngeal and
Right.
things like
7,
that.
9, and 10, right?
Right.
Nice.
Yeah. I had to think about that, yeah.
And what about
Yeah.
the sacral part?
So
What's
that's
happening down there?
so that looks like a spinal. They come out in the spinal nerves, and again, it's mixed somatic visceral.
Right.
And we'll talk a bit more when we get down
Okay.
into the gut and the pelvic organs. Okay.
For the spinal nerves, they just merge here and they
Yeah,
just
exactly.
snap
So
it
you
off.
see, each of these spinal nerves is actually giving off branches to this cervical thoracic ganglion or to this middle cervical ganglion.
But they are not snapping.
Some of them are, because they're visceral. So this, when you're looking at this, you're looking at something, well, not this necessarily, but here, you're looking at something that's visceral, right where the tip of my forceps are. This is visceral and somatic, and it's giving off visceral information to here. So we know it's visceral, but this is going to be somatic. It's going to break.
So the term spinal nerve, what does that mean?
It's what's coming out of the spinal cord. It's that
So are
dorsal.
those spinal nerves too? The
No,
sympathetic?
we can't. The spinal nerve contains sympathetic fibers, but not just sympathetic fibers, right? They also contain a lot of
So
somatic
spinal nerve
information.
just literally means the nerves coming out of the spine.
Correct.
Okay.
That's exactly right.
Just checking.
Yeah. No. That's absolutely true. It's confusing. I know it takes seeing this several times to get very familiar with it, and we will do it again in the gut, and we'll talk about it for as long as you want.
I do this